There are a number of different things that you can do as a nurse to assist with the client's breathing and oxygenation. One of the biggest things, of course, is getting them to quit smoking. And I think that requires a whole lot of long-term follow-up with and teaching with the patient. But things that you can teach them to do themselves, teach their families to do, include different kinds of pulmonary hygiene, breathing exercises, and positioning. And then oxygen therapy can be used as an inpatient for someone in the hospital. It can be used in a skilled nursing facility, it can be used as an outpatient at home. And so not only would you be doing that as a nursing intervention, but you could also be doing some teaching as well for the patient and the family if they take the oxygen home with them. One method to use in terms of smoking and tobacco cessation is known as the 5 A's. To ask about tobacco use, advise about the health benefits of quitting, assess their readiness to quit, and not everybody's ready or willing, assist in creating a cessation plan, and then arrange to follow up with them. And that follow-up is what is going to get results, the continuous support, because this is a tough addiction to kick. It is very, very difficult for someone to stop smoking. I have watched it more often than I even want to think about, people who are literally on their last breath and they're still smoking because either they don't want to quit or they just can't quit. An alternative to the 5 A's are the 5 R's. Talk to them and help them identify the personal relevance to them for quitting smoking. Why is it important to them personally? What are the risks involved for continuing to smoke? And on the other hand, what are the rewards that they would gain from smoking cessation? Help them decide what the roadblocks are that are keeping them from quitting, and then repeat this exercise every encounter, again, for the follow-up and the support that's needed to break this cycle of addiction. There are many different ways to help someone with smoking and tobacco cessation. One of the things that people do is behavior modification. There are a lot of situations that are associated with smoking. For instance, smoking after a meal, or when you're out to a bar or in other social situations. And the notion is to take that and substitute it with a healthier behavior during those times and try to make those a habit. Counseling is very important, either alone or in combination with a support group. This greatly increases the chance of success, and the more support the person has, the better off they'll be. Quitting cold turkey is much more effective than a slow taper, but a patient may choose to set a quit date and then try to taper off before that quit date. Nicotine is available in a number of different delivery methods as replacement therapy. There's gum, patches, nasal spray, lozenges, inhalers, all kinds of stuff that is out there to reduce the withdrawal symptoms. There are a couple different kinds of medications that are used. Bupropion, which is also Wellbutrin, is said to reduce cravings, and varenicline, which is Chantix, is something that they can use, and it blocks the nicotine. It attaches to nicotine receptors and blocks the nicotine, and so that reduces the pleasurable effects. You can take this drug while you are still smoking and then quit while you're on it.
It does have some significant side effects, one of which is really, really bad dreams. Um, but a lot of people use it very successfully. Acupuncture is another method that may curb the desire to smoke. Not a lot of conclusive research on this. The same thing with hypnosis, and I mean, the person definitely has to be open to suggestion that smoking is undesirable, or there's no way hypnosis is going to work. Physical activity sort of goes up with the behavior modification situation, where if you substitute physical activity at those times when you would normally smoke, it will reduce your cravings, and also it'll help with post cessation weight gain. And that's a big complaint of people who quit smoking, is that they tend to gain weight after they quit. So adding in more exercise will help with the mental health aspect and the weight gain aspect. Deep breathing is important in a number of different care situations. It's very important postoperatively. It's very important in people who have various sorts of lung diseases like pneumonia, COPD. It's very important in people who hyperventilate, people who have asthma. Really slowing down and breathing deeply can help in a lot of situations. To learn the technique, it's important that people understand the difference between chest breathing and abdominal breathing. So if you have them put one hand on their chest and one hand on their abdomen to feel the movement, the correct technique would be if the chest moves very little and they concentrate on moving the abdomen out during inspiration and then relaxing it on expiration, and really concentrate on the breath and the movement of the air. If they want to start deep breathing, it's important for them to clear their nose so that it's not stuffy. And sitting or laying down is okay if there's no other option, but sitting is really good because it brings your diaphragm lower and gives you more room in your chest space. Leaning forward on the hands with the elbows on the knees, arms and hands completely relaxed. That's a really good position. Take a deep breath in through your nose if possible, allowing the diaphragm to drop as they inhale, and then just keeping their hand on the abdomen and feeling the abdomen expand out. And then from there, exhale slowly. Sometimes it's good for them to count, and you can figure out whatever ratio you want to, 3 counts in, 6 counts out, however it works for them. And taking several slow, deep breaths at a time is a good start. And it will really slow their breathing down. It will help them breathe more deeply, and it will also help them relax. Pursed lip breathing is a special kind of deep breathing. It is particularly useful when someone is dyspneic. When you breathe through pursed lips, it provides positive back pressure on your airways that helps keep the airways open during exhalation. If you recall thinking about mechanical ventilation and PEEP, which is positive end expiratory pressure, or CPAP, which is continuous positive airway pressure, the whole reason for positive airway pressure is to keep pressure on those airways, keep them open, keep them from collapsing. So when people do this, then as you recall on the slide before, they need to use diaphragmatic breathing. And it's also always helpful to get them to count when they're inhaling and exhaling. It provides distraction and can reduce the panic as well, and helps them really concentrate on the breathing. One way to do it is to have them inhale slowly through their nose, maybe to the count of 2, and then exhale slowly through pursed lips to the count of 4. So expiration is always longer than inspiration. You really want to get that stale air out of the lungs. Something that you could tell them maybe as a coaching technique. If they inhale slowly, it would be like smelling the roses. So, and then as they exhale, it would be like blowing out the candles, but blow gently and slowly so that that wax doesn't splatter. So a real slow, steady exhale. You might need to breathe with them the first few times to coach them and get them to learn the rhythm by following along with you. One of the most important things that you can teach to people who have chronic lung disease is how to cough effectively. They have a lot of secretions in their lungs, and so they're going to cough anyway. Ineffective coughing is exhausting, and so teaching them a controlled coughing techniques helps them to preserve their energy. They can use this when they wake up in the morning and they have a lot of secretions that have pooled from during the night. They can use it after they use their bronchodilator medication because then their airways will be more open and hopefully that will facilitate removal of mucus. Or really, they can use it any time that they feel mucus congestion in their airways. Something for them to remember is that hydration can facilitate mucus removal. And so if they can drink 6 to 8 glasses of fluid a day, unless of course their doctor has told them to limit their fluid intake, as with people who have congestive heart failure, then the extra fluid thins the mucus and makes coughing it up easier. The other thing that's good for them to remember is taking deep breaths first helps to get more air behind the secretions and then makes it easier to get those secretions up. So as you see in this picture, to cough effectively, they need to sit on the edge of the chair or their bed with both feet on the floor. Lean forward slightly, and then they do some deep breathing and relax. Then fold their arms across their abdomen and breathe in slowly through their nose, remembering that the power of the cough comes from moving the air, so that deep breath is very important. Then to exhale, they continue to lean forward, pressing their arms against their abdomen and cough 2 or 3 times through a slightly open mouth. These coughs should be short and sharp. The first cough loosens the mucus and moves it through the airways, and the second and third coughs enable them to cough the mucus up and out. Then they should breathe in again by sniffing slowly and gently through their nose. This gentle breath helps prevent mucus from moving down back their airways. They need to avoid breathing in quickly and deeply through their mouth right after coughing, because this can interfere with the mucus up and in, out of the lungs, and can really lead to more uncontrolled coughing. People who have COPD oftentimes will have a very weak cough, and they have trouble getting the secretions up even with the controlled coughing technique we just talked about. So huff coughing may help. Instead of closing the glottis to generate a forceful cough, huff coughing keeps the glottis open and uses the abdominal muscles to create a series of forceful expirations. So think about that huff sound or the huff cough like you're cleaning glasses. You know how you'll go like that and you'll blow air onto your glasses and then clean them off with a Kleenex. That's that same kind of motion. Short huffs will clear larger airways, and a longer huff held for several seconds will open and clear a smaller airway. So it's very similar technique, sitting on the chair with both feet on the floor, taking slow, deep breaths through their nose, and then exhaling slowly through their mouth. Then the last slow breath, slow, deep breath through the nose, and hold the breath for just a minute before moving on to the next step. The next step would be to open the mouth and make that huff sound in their throat, huffing 2 to 3 times as they exhale. So breathing in deeply and huffing 2 or 3 times as they exhale. Then they can relax and rest for a little bit and repeat the steps as needed. An incentive spirometer is something that you should be familiar with from your skills lab. It is used to encourage deep breathing to decrease the risk of atelectasis. Sometimes we use it postoperatively for that reason, and sometimes we will give it to people who have pneumonia or COPD or are in another situation where we need to encourage them to breathe deeply, and this is a good visual to show them how deeply they are breathing and to challenge them to take deeper breaths. Do not confuse this with a peak flow meter. A peak flow meter is used in asthma, and it's when you exhale forcefully. An incentive spirometer is when you inhale. So they do is they put their mouth on the mouthpiece and inhale slowly and deeply, and that will either move a ball or a little bar or something on the device to show them how much tidal volume they're breathing in. And quite often you can set a goal for them to reach, and then once they reach that goal, you can move the goal up. What we usually talk to people about is having them use it hourly 10 times while they're awake. If they're sitting around watching TV, a good thing to tell them to do is to use it during commercial breaks. When you're teaching somebody to use this, really think about their developmental level, because it's going to be very different teaching a child than it is teaching someone older or even someone who perhaps has some cognitive problems, maybe dementia or short-term memory problems. But this is really effective, and if you teach them to use it, then they can take it home and continue to use it there. Chest physiotherapy, or chest PT, is sort of a global term that is used for things like postural drainage, percussion, and vibration. When you have people who have copious secretions and have a weak or an ineffective cough, they're at risk for retaining secretions and have a higher risk for pneumonia. People with cystic fibrosis, this is often the case. People with bronchiectasis, mechanically ventilated patients, and also some people with COPD. So this is a manual technique. Postural drainage is when you use gravity to help facilitate the removal of mucus from their lungs by putting them in a position that gravity will help drain the lungs back through the airways. Percussion is a cupping. You literally pound on their chest with a cupped hand, and then the air underneath the cupped hand sort of jars the mucus loose. You can also use your hands with a vibrating motion, or you can there's a special small vibrator that you can put on the outside of the skin to vibrate the secretions out of the lungs. These 3 techniques help remove the secretions from deep inside the lungs, but it's always helpful to get those airways open to facilitate drainage. So it's really good to do a neb treatment first, and that will open the airways, loosen the secretions, and make it easier to get them out. After you do this, there's going to be a lot of coughing, and so the controlled coughing technique that we talked about earlier would be good to use. There are alternatives to manual chest physiotherapy. One of them is a high frequency chest wall oscillation vest. There's a brand name that is called The Vest that Respironics makes, but there's also several other brands too. And basically what this looks like to me is a ski vest, and you put it on and Velcro strap it on pretty tightly to fit the kid. And then you turn on the little air compressor that produces vibration in the vest while the kid is wearing it. It's very useful with children. I don't know if you have ever thought, well, you probably never thought about it, but thinking about postural drainage and chest PT with a 2 or 3-year-old, I just can't even imagine them sitting still long enough to do that. But putting the vest on them is helpful. It's also useful for people with mobility issues. with older people or people who are on the ventilator or whatever. So there's a video in your module of a mom using the vest with her little baby, and that sort of gives you an idea of what it's like. The other thing you can use is a vibratory positive expiratory device. There are several of them on the market. There's one called the Flutter, and there's also one called the Acapella. There are pictures of those here. The Acapella is the one, the blue and green ones, and the Flutter valve is the one that's white. And those are things that people blow into, sort of like you would a peak flow meter, and they have little stainless steel balls in them, and these balls vibrate with the force of the air going through them, and that causes positive back pressure and helps to open the airway and loosen mucus. And also keeps the airways open because it creates positive pressure. These can just be used, you carry this in your pocket and use it. And then there's also a mechanical cough assist. You may have seen this at Children's Country Home or when you did home care for pediatrics this summer, and it's the same idea of loosening up the mucus, and then helps them to get it out. Positioning is important for energy conservation and for maximum lung expansion. Most people with significant lung disease don't tolerate lying flat, so they should either be in a Fowler's or a semi-Fowler's position. The tripod position is also a good one, and you can see a picture of that in this slide. Having a recliner chair available is often good, or a wedge under the head of the bed is good. Many people just sleep in the recliner. That's very helpful. Of course, the tripod, leaning forward with their elbows on their knees, or leaning over on a bedside table or over bed table, excuse me, opens up the chest cavity by dropping the diaphragm down. There are pictures on the next two slides, and those same pictures are in your book. And then there's also the notion that if you've got one lung that's in better shape than the other and you're turning them on their side, that gravity would increase blood flow to the good lung. So having the good lung dependent or the good lung down is something that you might think about when you're positioning someone. This is the classic tripod, sitting down, feet on the floor, hands on the knees, leaning forward, and that facilitates downward movement of the diaphragm. This is a variation of the tripod, also known as the orthopnic position, because remember, orthopnea is the inability to breathe flat. You have to have your head up to breathe. So you use pillows to support their back, lean them over the overbed table, and then put some pillows on that table to support them. So they're supported front and back, and can conserve their energy by not having to use it to sit up and support their weight.